On behalf of our speakers here and Carla, who will be on a video, and our sponsors, Stanford Biodesign, Stanford Surgery, and Fogarty Innovation, it's a privilege to welcome you all here to this now 25th annual Fogarty Lecture. I'll tell the story about the first one in a few minutes. In particular, it's a privilege to acknowledge Dr. Thomas J. Fogarty, the namesake for this lectureship. Tom, welcome. In lieu of a program booklet, we're going 21st century here, please scan the QR code for the program, bios, videos. You can probably make a donation on it if you want to. Just joking. This 25th annual lecture is entitled, "What Do You Do with an Idea?" And the answer is, you change the world. We decided this year, instead of having a single speaker, to pull out lots of big guns. And so our speakers are Carla Pugh, whom you'll see on video. I'll talk about her in a minute. Myself, Josh Makower, and Andrew Cleeland. And again, their bios are in the QR code link. And I'll give you a thumbnail when I ask them to come up. It's my privilege to first introduce Dr. Carla Pugh, our first speaker. You may not know her, but you should. She's Vice Chair for Innovation in the Department of Surgery and represents the next generation of surgeon innovators.
Hello, everyone. It's super exciting to welcome you to the 25th annual Fogarty Lecture Series. For those of you that I haven't had a chance to meet before, my name is Carla Pugh. I am the Thomas Krummel Professor of Surgery here at Stanford, and I am also a practicing acute care surgeon and Vice Chair of Innovation in the Department of Surgery. Just to think about something that has lasted for 25 years, it's super exciting. And I want to have you all think about what you were doing 25 years ago when this lecture first started. Some of you were on the fast pace towards exiting your fourth or fifth company or implementing a new medical device or technology. And some of you were innovation neonates, just getting out of the gate, just starting. When I think about what I was doing 25 years ago, I know exactly where I was. I was just finishing my residency in surgery at Howard University in Washington, D.C., and I had already made a critical decision that would launch my career as a clinician scientist and innovator. And that decision was, instead of pursuing a clinical fellowship, I would come to Stanford and get a PhD in education and technology. So 25 years ago, I launched my plan, but I hadn't quite gotten out of the gate. So I guess that makes me an innovation embryo. After coming to Stanford to get my PhD in education, within 6 months, I met Tom Krummel. And soon after, I met Paul Yock. Actually, Tom Krummel, when he heard of my career aspirations and dreams in the innovation space, advised me to go and meet with Paul Yock. And when I sit here and think about it now, I was so lucky to have the two of them as mentors regarding my career as a clinician. And fast forward to today, thinking about this lecture, 25 years, I am super excited to be part of this panel. And the first thing I thought to do was to raise the question, who are these past speakers? Why did they give the lecture? And what do they think about Fogarty and his legacy? So I actually want to share some of these quotes with you. So the first quote comes from Brooke Byers, and he said, "The annual Fogarty Lecture is both a cherished honor for the chosen presenter and a highlight of the year among Stanford's many links to the medical innovation community and ecosystem. Always inspiring and insightful, it is an exciting gathering of scientists, doctors, inventors, entrepreneurs, and healthcare leaders. Quote from John Adler, who was the 20th lecturer in 2018, and he said, "Few events celebrate the disappointments and joys of medical device innovation quite like the annual Fogarty Lectureship. It was an incredible honor to share my own journey, and if even for one day, feel like an industry hero." The next quote comes from Paul Yak, who was the 6th lecturer in 2004, and he said, "Recently, I've been trying to learn more about the history of medtech in the Valley. It's become even more clear to me that Tom Fogarty was the seminal figure, the godfather. This lecture series is a wonderful way to celebrate that legacy." This quote comes from Deborah Kilpatrick, who was the 18th lecturer in 2016. And she said, "For a medtech engineer, it is impossible to overstate the honor of giving the Fogarty Lecture. This is our community's chance every year to have a new conversation about translating inventions into patient impact. Our chance to give a new answer to Dr. Fogarty's constant question, how can I make this better?" The next quote comes from Mike Musalem, the 15th lecturer in 2013, and he states, "The Fogarty Lectures are as unique as Tom Fogarty himself, and it was a special privilege to be part of the program to explore, question, and debate important topics in patient-focused innovation." He also states that Tom has always had a rare talent for examining the accepted practice and asking, can't we do it better? He encouraged us to challenge the system. And finally, he says, the Fogarty Lecture has become a key conversation in the healthcare innovation dialogue, which highlights the stories of those who have relentlessly pursued innovations to improve the practice of medicine. And the final quote I will share with you comes from Jessica Mega and actually represents my own thoughts about the Fogarty Lecture as well. She states, "What an honor to deliver the Thomas Fogarty Lecture. I will always remember the feeling of community, productivity, and possibility on that night. Moreover, the annual event inspires us all to innovate and improve human health and to continue to challenge complacency. Thank you for creating this extremely special environment." Ladies and gentlemen, it has truly been an honor to share with you a few quotes and thoughts regarding this amazing lecture series. Again, 25 years, that is just incredible. And when you think about the title of this panel, what do you do with an idea? And we gave you the answer. You change the world. Thank you very much.
So as I say, Carla had dueling meetings, but it meant a lot to her, and I think you can appreciate why you need to meet her. You can only imagine how thrilled I was when she was named the Krummel Professor. So 25 years ago, I walked into Tom Fogarty's office to introduce myself as the new chair of the Department of Surgery and asked for him to help me with a Silicon Valley-inspired agenda for of innovation for the department. I also had the idea of a Fogarty Lecture as an annual opportunity to do exactly what Carla told us about. The notion was that big ideas and conversation would inspire new big ideas. I got the usual Fogarty snort. Who would care? Would anybody come? Look around. I told him, Tom, I'll do all the work. He warmed to the idea. I assured him it wouldn't cost him a dime, and I'd buy Fogarty wine at retail price for the reception and dinner. Dr. Fogarty was all in. Now, 25 years later, what do you do with a good idea? It turns out the Fogarty Lecture was a good idea. We pulled the title, or created the title for this lecture from that brilliant children's book with the same title, What Do You Do with an Idea? The story chronicles the long, hard slog full of doubts and setbacks. It concludes with the second half of the title, quote, You Change the World. The previous 24 Fogarty Lecture speakers have all changed the world with their ideas, and their list is on the QR code. The invited speakers have had a broad mix of backgrounds, from docs, engineers, entrepreneurs, and business leaders. There were 12 innovator founders, 7 institute founders or directors, 2 university presidents, Hopkins and Stanford, not bad. 10 C-suite execs from Fortune 50 companies, the director of both the FDA and CMS, the leading life science venture capitalist, Brooke Byers, the leading life science attorney, Casey McGlynn, and Time Magazine's Man of the Year, Andy Grove. Like, pretty good list. It all started with lecture number 1 in 1999 with the story of Tom Fogarty as a scrub tech in the 60s. Tom witnessed the expert surgeons of the day making a gigantic incision from the groin to the knee, okay? That's a big-ass incision. Trying to get, and then opening the artery over that entire length to try to pick out a bunch of clot. Scrub Tech Fogarty then made a simple observation. Those patients all came back to the operating room for an amputation. Fogarty was assured, this is a great operation, state of care. Tom sort of said, bullshit. How good can it be when the result is an amputation? Tom, as a scrub tech and then a medical student, radically rethought the way we think about getting clot out of arteries. The balloon catheter idea was vilified. The paper was never published, and it became an overnight sensation. His boss at the time told him, this is a dangerous device and a procedure that borders on malpractice. Only one so uninformed as a medical student would dare to think of it. So when you hear stories about students from Josh and Andrew, that's why we get students involved. It's fair to say that the balloon catheter revolutionized not just embolectomy, but the entire field of endoluminal therapy in the cardiovascular system. A mere 50 years later, Dr. Fogarty was awarded the National Medal of Technology and Innovation by then President Obama. Tom changed the world. For my brief segment, I'd like to just finish and extract 3 simple takeaways from the previous 24 lectures. Those takeaways are: 1, ideas are fragile and implementation is hard. 2, if it's so hard, why bother? And I'll try to make the case for why we should. And finally, that mindset matters. Ideas are fragile and implementation is hard. Anybody in the room that's tried a new idea, even if it's to change the date of something, is like pretty damn hard. We know that a weekend hackathon with whiteboards, Post-it notes, cute games that might work for a pizza delivery app just don't work in healthcare, whether it's med tech, biotech, or health tech. As Brooke Byers in the Fogarty Lecture number 21 taught us in his fireside chat, the quote, surrounding pervasive tech mantra of move fast and break things may work at Facebook or in tech, but it doesn't work in healthcare. The plain reality is most startups fail, even those that get early funding. And if anyone's paying attention to the outside world, it's an Armageddon right now in terms of early stage medtech startups, even with FDA approval, even with a going concern. And I can tell you that's the perspective from Sante Ventures. We do believe that a supportive ecosystem with full contact mentoring can facilitate success of this very hard thing. And Stanford Biodesign and Fogarty Innovation are prime examples of that. Stay tuned for Josh Makower and Andrew Cleeland. Of the past 24 Fogarty lectures, every one of the innovator founders did describe what turned out to work, and it's sort of like an overnight sensation. Nope, didn't start like that, because most of them described missteps, mistakes, dark alleys, trials and tribulations, and the dark days of staring into the abyss of, we have no money, and I have no earthly idea how we're going to go forward. And yet their stories inspire us all to do what they do. They learned from what didn't work to inform them what could work and a path forward. And finally, the old surgical aphorism, good judgment comes from experience, and a lot of experience comes from bad judgment. That's just the way it works, as it turns out. Don't forget it for the young people. Why bother, right? If it's so hard, who cares? Why don't you, go do something, go cut grass. I would argue that the ability to leverage a good idea and solve important patient healthcare problems is a phenomenal adventure. I borrowed these three pictures, cartoons from Rodney Perkins and Fogarty Lecture number 4. Rodney showed this, how one doc taking care of one patient does one unit of healthcare. We might even call it an RVU. I hate that term. We know when we train a next generation, they multiply what we do. So you push on the lever, they go out and do what we do in a multiplied effect. That's compelling. When you develop a new solution, the impact is profound. In the upper panel, you see a picture of John and Mary Gibbon, who invented the heart-lung machine to do an operation that we never do anymore. But the heart-lung machine enabled the entire field of cardiovascular surgery. Bill New, sitting next to Tom Fogarty, revolutionized anesthesia safety with the first commercially successful pulse oximeter, and it went from a curiosity to the gold standard in less than 6 years. Farrell and Powell, over now a 20-year experience with the MitraClip, changed the way we think about catheter-based therapy for mitral insufficiency, and Farrell left us too soon. John Adler, who you heard in a quote, changed the entire field of frameless stereotactic radiosurgery, basically putting himself as a neurosurgeon out of business. And of course, Jess Mega, who's here and joins us, and Jess, thank you for not only joining us, but your comments. Jess is now, as a brilliant cardiologist, brought data science to the numbers game in healthcare and is revolutionizing the way we think about machine learning and artificial intelligence. All of them have produced big-time leverage. Finally, Stanford Biodesign and Fogarty Innovation will help us answer the question, well, what if we could multiply that exponent? It could get real big real fast, and we're privileged to have a number of the biodesign trainees and a number of the Fogarty companies and residents here. I'll show you in more detail what happens when 3 physician inventors, innovators, and guys I'm privileged to call friends produce leverage. Rodney Perkins, Paul Yock, and Tom Fogarty, all Fogarty lecturers. Rodney was number 4, Paul was number 6, and Tom was number 1. Between these 3 physicians, more than 60 successful startups have been launched. Think about this, 70 million patients have been treated directly as a result of their inventions, ideas, and entrepreneurship brought to bear, and their lessons of explore new therapies, especially where things aren't working, expect to fail and keep going, are a remarkable lesson to all of us. That is leverage. Last lesson, mindset matters. This is a conglomeration of the 25 Fogarty posters, and they're also accumulated in that little commemorative book we have there. And every one of them, in one way, shape, or form, talked about mindset. I'll give you my two cents on mindset. The first is from John Schaar, who was at UC Santa Cruz, a, quote, futurist. He makes the point that the future is not a choice between we're going to door A or door B, door number 1, number 2. Rather, it's a place that's created. We decide what doors we want to explore. We think about it first in what we think and in what we decide to do, and then it's created in activity, because in the end, an idea is useless if it's not implemented. The future is not some place we're going to, but it's one we're creating, and the path is not to be found because it doesn't exist. Rather, it's to be made, and the activity of making those paths changes both the maker and the destination. I think everyone in the room that's had a shot at this gets that. Finally, I think it's fair to say that Kennedy had it right in 1962. He said, we choose to go to the moon and do the other things, not because it's easy, but because it's hard. Because the goal will serve to organize and measure the best of our energies and skills. And because the challenge is one we are willing to accept. In quick summary, we celebrate 25 years of Fogarty Lectures and their perspectives on what do you do with a good idea. Did a little reality check on, hey, we're all about startups, this is hip and cool, like it's really hard, and don't think otherwise. Wanted to highlight from Rodney Perkins' example the profound leverage of a good idea that's well executed and mindset. And I'll leave you with this.
When you grow up, you tend to get told that the world is the way it is, and your life is just to live your life inside the world, try not to bash into the walls too much, try to have a nice family life, have fun, save a little money. That's a very limited life. Life can be much broader once you discover one simple fact, and that is everything around you that you call life was made up by people that were no smarter than you. And you can change it, you can influence it, you can build your own things that other people can use. Once you learn that, you'll never be the same again.
You can build your own things that other people can use worldwide. It's my sincere hope that this 25 years of lectureship has helped guide us all to a bit more of a Steve Jobs mindset. It's now my privilege to introduce in sequence Josh Makower, founder and director of Stanford Biodesign, to speak, followed by Andrew Cleeland, who's CEO at Fogarty Innovation. Josh, take it away. Thanks.
Thanks very much, Tom. Thank you. Very few people may know that Tom recruited both Andrew and I to our current roles. So thank you, I think. He should have gone on to be an executive recruiter, I think, would be a good skill to highlight. Well, it's a pleasure to be here, an honor to speak at the Fogarty Lecture. Tom, thank you for creating this. In honor of Tom, who's here, it's an honor to see you as well. It's a privilege to get a chance to tell you about biodesign, and I think it's appropriate to talk about what do you do with an idea, because in a sense, biodesign is an idea. And today, our purpose, biodesign's purpose, is really to have an impact on health outcomes and health equity through three different means: innovation, translation, education, and also policy. And I'll talk about how we've arrived at that. I'll give you a little bit of idea of the history of biodesign and some of the accomplishments over this period of time that we've been around, which is actually shorter than the Fogarty Lecture. We've been around for about 23 years, and Fogarty Lecture has been 25. So, this is the idea. Innovation is a discipline. It's a process. It can be taught. You can learn how to do it. And I think many of us, when we see this, and I would say growing up, I believed that you had to be special. Sort of the idea would just brilliantly come to you. You'd discover it just by happen chance, or it would pop into your head, and then you'd be able to go execute on it. And therefore, somewhat unreachable, a sort of unattainable thing to be able to do. That was until 1989, when I was freshly out of medical school, engineer. Just by way of background, my parents were both teachers, and I was asked to do a side project by the CFO of Pfizer. He said, why is it when we acquire these little companies, these little med tech companies, they were so innovative before they showed up, and then we acquire them and they don't innovate that well anymore? What's going on? Can we do something about this? And that was the opportunity that absolutely changed my life. Because I had the opportunity and full license from the CFO of Pfizer to go interview the founders of those companies like Valley Lab, Bob Anderson, Pfizer Laser Systems, Howmedica, which was a hips and knee business, et cetera, and really walk through their journeys as they began and identified the products that created those companies and made them so successful. And then I had the other opportunity to interview all the folks inside of the now larger company, many of the founders now gone, and understand how they were prosecuting and working on new projects. And the processes couldn't be more different. But they were different in very interesting ways. The key was, when the innovators were sort of on their own and starting their startups, they were focused on the needs of patients. They were looking at the problem first and then going to find a technology to solve that problem. Quite the reverse, once the, let's say, balloon catheter company had become successful, now they were, as a big company, looking for other ways that they could use balloon catheters or improve on the efficiency or performance of balloon catheters. Very different think and much more incremental. And so, with my, sort of parents as teachers, understanding that you teach something by breaking up a complex subject into parts, we basically broke out the steps of innovation to look a lot like what is now we call the biodesign process, with the first step in understanding patient needs, trying to qualify and quantify them, understand all the stakeholders involved, move to a specification that you can invent to, and so on. And that was the foundation of my incubator, ExploreMed, which has produced many companies. At the same time, around this time, Paul Yock was creating a community of med tech here in the Valley. It was called Medical Device Network. And really, getting leverage from all of the sharing and interactions that, really characterize everyone in this room, and building that energy. And the two of us sat down in the year 2000, and Paul was very interested in trying to create some sort of training program here at Stanford that would actually elevate medical devices and be a center point for medical devices and draw this network that he'd pulled together to benefit this community and train the next generation. And I suggested maybe this methodology that we've been using at ExploreMed to create companies could be something we could teach to others and could be leverageable, and we could actually teach innovation. And so the two of us together founded Biodesign around the same time that BioX was also created. Our first fellow started in 2001. It was 4 fellows, a small building over there, CCSR. And we began this journey that's really taken us quite far. Our first graduate class in 2002, and then the beginnings of our work to expand, to share this knowledge outside of Stanford through a textbook, and across the world, working with other countries as well. That work continued and expanded to include Singapore, Japan, and most recently expanding to include our partnership with Fogarty Innovation around diversity, called D by D, led by Ingrid right here. And in the last couple of chapters here, with Paul now retiring, I had the opportunity to step in and really try to imagine, what is the future of biodesign. I'm going to talk a little bit about that in a second. The key part of the future is always people. I think all of you that know how to build your companies, how to build your startups, it starts with the quality and integrity and thoughtfulness of your people. These are our people. This is our executive team, and behind this executive team are 150 other individuals who make biodesign work here at Stanford and across the world. They're working part-time, they're working full-time, but they're amazing, amazing people, and that's always the fiber of a great organization. Also our board. We created a board to help guide us. I'm sure you know many of these folks. It's a diverse group of people coming from very different points of view to help guide where the future is going for biodesign. And biodesign's blossomed, from that initial individual graduate class to a group of 4 fellows. We now have 12 fellows in innovation, 4 in policy, and numerous classes and other activities. A lot of partnership with the Fogarty Innovation as well, across a wide array of educational and experiential growth opportunities for students and trainees. We touch about 500 people directly each year, and they have produced some amazing companies. I often say, our goal is not to create companies. Our goal is to train people. But in the process of training people, as Tom often says, you teach people how to fish, and they actually wind up catching fish, and this is sort of a good example of that. But what's also interesting is what they do after. Those are the companies that they created while they were being trainees, and then they've gone on to create many, many more companies, and we've produced several serial entrepreneurs that have just gone on to help so many people with so many conditions. And I'm just so proud of our fellows and students and trainees. It's just an amazing community that's been built. And today, and these numbers are probably already outdated, when you just look at the companies created by our trainees while they were trainees, they probably touched well over 10 million lives at this point. And that's just an amazing accomplishment. And you can see that the power curve is just growing exponentially, and it will continue to do so. The other element here, though, that's quite interesting is it's not, obviously patients have always been our primary focus, and that's the right place to focus, but the economic impact of all of this innovation is actually quite significant. Investment return and investment opportunity, the jobs created, it's quite fascinating. And this is the reason why countries across the world have adopted biodesign, some of them as a national mandate, to create a health tech environment utilizing the biodesign process as their sort of fundamental engine to actually create companies that are going to create jobs and address the healthcare issues of their citizens, and bring in investment, bring in acquirers, and a whole community and ecosystem around this. And it's really been gratifying to see this happen. We've obviously fueled it with our training programs that train global faculty across the world. And it's amazing to see, sort of back to this premise of tonight's talk of just how the world could be impacted by just a really simple idea of biodesign. And not to mention just, countries, but also companies. It's impacted the way that many large companies do their upfront R&D and strategic marketing. So, looking at the future, what does the future of biodesign look like now? I think these are the 5 pillars that we as a management team, executive team at Biodesign have aligned on. The first is, let's make sure we don't mess up the good stuff that we're doing. Let's protect the core. Let's continue to offer the great experiences that we have for students and fellows and faculty, and continue to build and enhance that experience. We also want to make sure that we are sustainable. Very few people know that Biodesign is funded purely and completely with donations. And this is a real special mission for me, to make sure that Biodesign can be here for generations to come. I'm really hoping that during my tenure I'm able to secure enough of an endowment that we can actually put biodesign into a position that it'll be survivable for the next director and future fellows and trainees. Now, with respect to programmatic new areas, there are three. The first one we call Biodesign Life Sciences. The idea here is that today, biodesign is a way of inventing something, right? And we were sort of thinking it was med tech. Then we added sort of digital. But the truth is that today, when you can design a vaccine over a weekend, the tools are available to actually develop molecules based on a need, to understand what the mechanism is, understand those molecular receptors, and actually design for purpose a molecule to solve a problem. And to have in mind all those stakeholders' needs when you're doing that gives you even more power to actually produce something that will be delivered in a format and a cost and an efficacy that is fit for purpose. And so the first concept here is to reimagine biodesign as a tool for inventing anything that can be designed in healthcare. And that's the first mission, and we're powering this with our fellows who've actually used the biodesign process already to create companies that are in the biotech and other areas, diagnostics and so on. So it's pretty cool expansion of our platform. The other one is really focused on global health equity. In the past, we've been approached by well-heeled governments looking to enhance their economics, as I mentioned, and that has allowed us to survive, quite honestly. Those funds that we've derived from those relationships have, paid for many of the educational experiences that we've been able to provide. But we ask ourselves the question, can we do more? Can we use the biodesign process to actually have an impact in global health equity and actually use this purpose to think of the opportunity before it's invented? We are often looking at trying to address health equity after the solutions have been invented, and those solutions might be very expensive, very difficult to implement in various environments. But can we back up and introduce health equity upstream when we see the problems for the first time? That's really what we're trying to do here. And our first footprint into this is that we're building a new biodesign effort in East Africa in partnership with the Gates Foundation, in partnership also with the University of Global Health Equity in Rwanda, as well as Kenyatta University in Kenya, to actually create a biodesign footprint there to service the needs of that community and also to train people who are there in East Africa and give them an opportunity to be entrepreneurs, to create jobs, and actually address the health needs of those populations, which might be very different than here in Silicon Valley. So that's been very exciting, and it's really off to a great start. Our last and I think very significant step forward is also to recognize that we as innovators also, and this means all of us, not just biodesign, but everyone in this room, really needs to understand policy. Policy impacts our ability to get patients the care that they need and the technologies that they need. And so and I think Tom was an early leader here, engaged with the FDA, even way back when early legislation was being formed around 510K, et cetera. Tom was there in engaging with policymakers, trying to make sure that they were thoughtful in the way that they formed their policies so that innovation could succeed. I think we at Biodesign, we take this seriously and have now created a Biodesign policy program. The objective here is to create the next generation of policymakers who we're going to send into the world to be thoughtful about the challenges that innovators face, to understand the innovation process, and as they regulate, whether it's FDA, CMS, in the White House, or in Congress, to have someone in the room where it happens that understands this process and actually can guide it towards something that would be much more compatible, much more efficient, and give patients the new technologies that they need. And the process, the areas that we're going to cover are quite broad. All of the key areas, payment and reimbursement, IP, et cetera, and to give them a foundation in all the areas that they need to understand this process. And it wouldn't surprise you that as we try to identify how do we approach this, we're going to actually produce research. And we've already started doing this already, But the idea is to use a very much like, let's find out what the needs are. What are the needs of the innovators? What are the needs of patients? And let's look at ways that we can influence policy and have an opportunity to give policymakers information that they need to properly adjust policies for the future. And I think, as a case study, Sandy Ruggles and myself and others have worked to give a prototype of what this could look like by creating a set of data around this area of accelerated Medicare coverage and show pieces of information that really weren't known or described before, but they're quite powerful in making policymakers understand how much this matters and how big a challenge innovators face. And it is making a difference, and our work is being cited, and we've been asked to testify in Congress, and it's working. So this is the idea multiplied by 4, 8, and then many more. And we're so fortunate to have our first policy fellows here somewhere in this room who will take that mantle forward and really go out and make a difference for patients. So in closing, I just want to say, thank you for giving me this opportunity to talk about biodesign here. This is truly a simple idea. I often think about biodesign as enabling people to overcome their fear to innovate, to give them the tools to think about the possibility of changing the world and make it less daunting and much more achievable because there are simple steps that they just need to follow, and really focus on those people as the vessels of change. And here they are, our fellows. We're so proud of all of you and all of our students, and congratulations to all of you, and thank you, Tom, for giving me a chance to speak today.
It's always tough when you get to follow two icons in our industry. So I'm going to have a little bit more fun and tell you a story of how I have the greatest job in the world. So Tom, thank you. Genuinely humbled, really appreciate this opportunity. But I wish I knew I could have done this by video. From Italy would have been great. All right, so I'm Andrew Cleeland. I have the good fortune to be the Chief Executive Officer at Fogarty Innovation. So I do follow, Tom also happens to be the chairman of the board. So when he gives me direction, I actually do follow it occasionally. So what do you do with an idea? So I'm going to spend the next 2 hours telling you. I think this is really important, and this comes from Tom. An idea by itself has no importance whatsoever. It's the implementation or the translation of that idea and its acceptance by others that brings true benefits to our patients. All right, so it's taking that idea and spending the next 12 years bringing that to fruition. I stole this from Paul Yock, who, if he's not here, I hope he's watching, just to say every presentation I give now has a photo that Paul's given, an icon that he's given me. It is a truly daunting journey, bringing a new technology, a new therapy to market. And importantly, I think that the journey itself involves balancing the needs of an interdependent community of people. And I think that's really important. It's what we call the medtech ecosystem. And I want to look at that as not companies, not FDA, not institutions, but it is people, and that's the way in which we try and approach things. This is how we see the ecosystem. It's patients and their families, not just patients alone, but their families. It's physicians and providers, it's regulatory agencies, it's insurers and payers, it's investors and acquirers, and then there's us, the entrepreneurs and the startups. As that ecosystem, over my career, I'd say even over the last 10 years, as that ecosystem has matured, each individual component of that ecosystem has made things more complex. Sometimes the intent is good, but it is just the law of unintended consequence that by doing things better, it makes it complex for those of us that are following along the line. And if something's more complex, it takes us more time, and if it takes us more time, it takes us more money. And I was thinking when Tom was talking to you guys about how tough it is, the last thing I wanted to do was go and pile on, but I'm going to. So just by the numbers, this is something I just saw the other day. Pitch book. And this is just a cohort from 2010 to 2016. There were 7,034 companies that got seed funding. 4,470 of those went on to receive subsequent funding, and 947 of those went on to achieve some form of an exit. So an exit. So then you add that to this. This is a look at the venture ecosystem over the last 10 years. And what this shows is 60% of their portfolio returns less than 1 times invested capital. Right? Less than 1 times. In other words, less than what was invented. So what we're looking at here is less than 5 companies. I think when I did the math, it's something like 4.23. But given the fact that everything is a bit hazy, we'll just round it up to 5. So 5 in 100 survived to an exit. Right, that's pretty scary. And so this little guy. So this is what we're about. Fogarty is here to help that little dude get out there into the water and protect and hopefully go on to to live for a couple of 100 years. We started. We're the younger one on the block here when we're looking at these 2 programs, and we actually reflect this guy. Right, we're still that scrappy kid from Cincinnati, and totally reflect. I'm not going to go and talk to you all everything that Tom's done, but I am hoping that our team can provide a legacy for him in Fogarty, and that's something that I was watching Tom get teary before. Didn't think I was going to get teary. But I want to leave it with that last one in green there. Our leader, Tom, is an iconoclast, and by that I mean that he will always look to disrupt. He will always look to not accept the status quo. I think that we have taken that to heart. One other, to use one of Josh's terms, one other pillar of ours, or one other truth of ours, is it really comes down to this, that Tom made a comment, and makes this comment a lot, that he wouldn't be where he was today without his mentors. I would say that's true for everybody in the audience who's had the good opportunity to have a mentor. So that is what flows through Fogarty Innovation. So then along comes us. We are looking to shape the future of human health, and you're going to show you how we're going to do that. Over the last few years, our team has grown. And this is the one area that as Josh just said, success only comes through people. And if I am proud of one thing, it is this group of people. They are world class. I am so humbled to be able to attract a group of folks like this. Right? They're all seasoned, proven innovators. This is our coaching team of 15. 450 years of experience in 80 plus companies. We've been successful, $6 billion returned to investors through acquisitions and IPOs. Each one of us has also had a colossal failure. I actually caught myself and not swore then, Tom. They were handpicked and very deliberately picked to have specific domain and functional expertise so that we could help our younger companies. We have exceptional access to the medtech innovation community, and it is you guys that make Fogarty run, and I dare to say it's these folks that make Biodesign run as well. I haven't seen an industry that actually supports each other as much as what this industry does, and I'm thrilled to be part of it. And I had to put that last bullet down there because Tom invited me to speak. So we've moved from Tom's backyard, where this is, and we're now in a beautiful 30,000 square foot facility on the campus of El Camino Hospital. It is a world-class facility. It has an impact on our companies. It has an impact on investors visiting our companies. As I said, 30,000 square foot, wet, dry labs, everything that you need to run a world-class program. We believe innovation is best learned by doing. And at our core, at our heart, Fogarty is an incubator, helping innovators get their ideas to patients through full contact coaching. You saw Tom use that term. I use that term. It was first coined by Paul Yock in describing us, and we have latched onto that as what we think is a remarkably accurate way of what we're doing. We've moved from coaching, we are using the term coach and not mentor to make a distinction between a telephone call once a blue moon to being we are in the trenches side by side with these folks. We've grown. Originally what we were recognized for was what's known as the Company in Residence program. You can see that over the years we've added 3 other programs, and I'll talk about each of those in a second. But the whole concept of these 4 programs to accelerate the invention, development, and deployment of new technologies into clinical care. The Company in Residence program is aimed at seed stage companies. They're normally 1 to 5 people. They do have a little bit of capital, but not much. They come and live with us for ideally 2 to 3 years. Some have been longer. But the point is that this is an opportunity for us to get to really know the therapy, the technology, the challenges that they have, but more important, to get to know the people and to work as closely as we can with these folks and help them develop. We're looking at the Invention Accelerator program is one of the partnerships that we have with Stanford, and sorry, I thought someone was clapping with that we had a partnership. It wasn't Gordon. And the Invention Accelerator program is working with researchers and inventors and just helping them understand the path forward, what it's really going to take, that journey. We outline that journey from better understanding the clinical need, better understanding the true value proposition, intellectual property, what's the landscape look like, through what the reg clin reimbursement pathways are going to be. And that, Josh, is something we never used to say, just reg clin, but now probably start with reimbursement. Through to something as simple as making sure we understand the capital requirements. I do think that most folks come to us, most inventors come to us and we're only going to need $2 or $3 million and we're going to be commercial. Not likely. Company Accelerator is something, this was a little bit opportunistic. So this is for later stage companies. We had some inbound requests to help coach companies through particular problems that they have. And what we realized is we have a pretty good consulting group on staff. And so we've had now, I think we're up to about number 6 of those, and that seems to be working really well. The last one is something we have actually been doing for a little while with some Japanese companies in Terumo and Mitsubishi, but more recently we have a relationship with Medtronic where we are involved in what they call their strategic bet program of bringing companies out of Medtronic, not a build to buy. This is a true acceleration program where we have some unique access to Medtronic therapies and technologies in a way of advancing their needs. We have a current portfolio of 21, so I think that might surprise some folks. We're actually getting bigger. But importantly, if you remember those numbers before, 5 in 100 succeed, 95 in 100 don't. We also want to focus on that 9,500 because within that, 9,500, sorry, that 95, that there are remarkable innovators in that group. There are remarkable, ambitious folks that we want to help them make the second time around. We want to encourage them to go second time, and we want to help them so that they go through our process. We want them to become better at what they do. And so the only way you can really do that is through education. Because as Josh said, and I'm not sure who stole what from who, but it looks remarkably similar. That we believe innovation is a discipline, the same, right? And maybe it's just because it's bloody obvious. No, one of us is taking credit. We believe that innovation is a discipline, and if it's a discipline, it can be taught. And if it can be taught, you can improve, right? And so what we're trying to do is pass on lessons from our experience and from those folks in our industry that have done it before, so that we want our, we really do call it real-world education. It gets back to Tom's grittiness, right? This is from real experience, hard-earned experience. We want to provide meaningful, engaging, and lasting impact. This doesn't want to work. So over the last few years, we've had the FDA fellowship and the Leftorov internship for a while now, but we've also grown our education offerings, and it's pretty complex. So I needed a little red thing so I knew which ones to talk about. So this is not for you, this is actually for me. So the core curriculum is something that we offer the folks that are inside, the 21 plus companies, plus Stanford Biodesign, and a few others. And this is what we sat down as a team and just said, if we had to do this again, if we had to start again, what would we want to know? And so, this was simple things like leadership, fundraising, organizational growth, intellectual property, and a few other things like that we felt would be useful for first-time entrepreneurs. And it's not just our folks who are teaching this. We have the good fortune to be able to bring in folks from Wilson Sonsini and other firms, from all of the banks, all of the venture capital groups, and to provide half-day seminars. Many years ago, and I think, again, you were right, Josh, that Tom was a pioneer here in working with FDA. But the way I hear the story, it wasn't as nice as the way you described it. Jeff Shuren told him to put his money where his mouth was, and to start a program. And so we did. It's what was called the FDA Fellowship. So 3 to 4 times a year, FDA comes out and spends a week or two with our folks. We embed them in some of the companies, and we provide them with a relatively unique experience. We just had a group come out. The most junior person there was a senior reviewer through to a division director. So these are folks, and we were informed that 80 people applied for those 4 slots. So what that tells me is there's a lot of opportunity there. But really what we're trying to do is just humanize it, right? They get to deal with the bigger companies all the time. It is rare that they're truly dealing with the smaller companies. And what we wanted to do is just show them that the other end of the telephone is Steve and his 3 employees, right? It's not 50 folks, not 5,000 folks. It is 3 people working their butts off. And vice versa. We wanted to show our folks that the FDA guys are also just scientists and engineers trying to do a real job. And just to try and get us to be working more closely together. A little bit of an opportunity. Denise has been running this program, and when COVID hit, FDA came to us and said, we want to continue this education. Clearly we can't travel. How do we do that? So we ended up with a webinar series. We provide a webinar once a quarter to them, and they want it to now to go every 2 months. The last one we had 300 to 400. I think we sort of averaged between 300 to 400 people on at a time. That might not sound much to you guys, particularly when you look at this room, but CDRH is only like 1,900 people. So at any one time on those calls, we've got 20% of FDA on a telephone call with us. I think that's pretty impactful. The Leftorov internship is each year over summer. We have an 8-week program for college kids. Highly recommend this to maybe not to anyone in this audience, but to your kids. Get them to come in, because it is also awesome for us, because I tell you, having a group of 20-year-olds in the building changes it. We're not Stanford. We don't get what you get every day. It is awesome, particularly for some of us who are getting a little older and jaded. And Not looking at you, Mike, that's me. So that's an awesome program. Diversity by Doing, Josh already touched on, but I think it's led by a remarkable duo, and both of you too, thank you. And this one, and I'm saying this last one. So last year, you guys, I'm hoping all of you know about TCT, right? So it's 35th year this year, a remarkable cardiovascular conference. We got a telephone call saying, hey, we do a brilliant job on the science, we do a brilliant job on the clinical medicine, we don't do a really good job on medtech innovation. Could you guys help us? I was like, damn, yes. So we worked with them to set up a day of activities or a day of presentations, 2 tracks of courses. We were anticipating 200 people. We had a room for 500 just in case, and we got 1,400. I've been telling people 1,800, but I was corrected recently. It was only 1,400. So we're doing it again this year. So sign up, October 23rd. I'm expecting to see you all there. It's pretty cool. All right. Our mission is to strengthen not just the Bay Area ecosystem, not just the Californian ecosystem, but the global ecosystem. So we find opportunities anywhere to help. Our programs and alliances have had global reach. I'm thrilled to say we're in Japan, Singapore, Canada, Israel, Taiwan, and Australia so far. We want to continue to expand and offer. This one's interesting. No. But I know, Kathy, you better get your button picker up. I am not going to be the person holding that up. I got to tell you, look, we're all of us, all the Fogarty team are, sorry, my little thing fell. All the Fogarty team, we're from industry, right? There's no doubt we've worked for profit forever. And we have an argument probably once a quarter. Should we become a business? Should we become for profit? And then we realize this. We can't do what we want to do. We're here to have an impact. The way we can have an impact is this, to forge stronger alliances amongst innovators, academia, industry, and government stakeholders. We can only do that in the form that we currently are. So what do you do with an idea? You challenge it. Right? You don't accept it, you challenge it. And I apologize for those of you who've gone through one of our physicals. We do challenge it, and so you should. You nurture it, right? And dare I say it, you incubate it. But you nurture the idea, and then you change the world. It's not the end, Tom. So who would have thought that these 2 unlikely characters would have changed the world? But they have, right? You heard Tom. I don't have a whole slide set on Tom Krummel, but we should. I didn't think of it until just now. But the impact that these 2 gentlemen have had on our industry, on millions of patients, is profound. One of the things at the 2 companies that I had the opportunity to lead, we used to talk about one thing, and that is if you could change one person's life, just one. If you were walking through the airport and someone fell over, and you went and gave that person mouth-to-mouth piece, and you revived them, you're going to remember that for the rest of your life, that one event. That's what we do in our industry every bloody day, right? And not just one patient, but thousands, millions. That's what you guys, and I guess where I was trying to go with that is both of these gentlemen have been mentors to me. They've impacted my life. So from my perspective, I'm humbly thank you guys. And I'm actually going to ask you guys to all stand up for a second and give them a quick round of applause. Thank you guys. Keep going. Thank you. All right, I'm going to end. Yeah, sorry, I forgot this one. What you don't see is that book. That book there is I can't remember, I got to look at it again. Yeah, the butchering art. I thought that was so appropriate. We got two really good butchers with us. So I'm going to leave on this note, and this is one of my favorite sayings at the moment. I think this is allegedly from Hannibal as he was looking up at the Alps. I'm either going to find a way or make one. If that is not what we do as startups, I don't know a more apt quote. But as I was doing all of this and looking through tons of old photos, found this next one. And if this does not aptly reflect the boss, I don't know what does. Check that out. So thank you all.
So standing room only, Friday night, 6:10. Don't you feel lucky to be here? I do. It's been a marvelous capstone to 25 years of Fogarty lectureships, which have not just chronicled, but I think inspired and advanced the state of the medtech ecosystem, not just in the Valley, but across the world. Please join me in a round of applause for all our speakers, past and present, and to all the marvelous administrative support over the last 25 years. So we'll adjourn to the reception on the Dean's Lawn for some joyful conversation, reconnections, and some Fogarty wine. Okay, thank you all so much. Thank you.